Hello there and welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from the beautiful Dusit Princess Hotel and Residences right here in Nairobi. So today on the show, we'll be focusing on sinusitis. And I'm pretty sure you've had a lot of people saying, my sinuses are flaring up or I have sinuses here and there. But do we really know what exactly they mean? And did you know that there are some birth defects that could lead to sinusitis? Well, we'll be talking about that and much more after this fact of the matter. A sinus infection, also known as sinusitis or rhinosinusitis, occurs when the nasal cavities become infected, swollen, and inflamed as a result of an inflammatory reaction or an infection from a virus, bacteria, or fungus. It can cause facial pressure and pain, stuffy or runny nose, and sometimes a fever, among other symptoms. All right, let's get to understand more about sinus infection, or if you like, sinusitis. And to help us with that conversation, we have Dr. Saras Karuga, who is an ENT and neck as well as a head surgeon. Again, here to share insights. So karibu sana daktari. And we also have Amina Warsan Abdirizak Amina. Hey, long names. Good to have you as well. Thank you so much for agreeing to come and speak with us about your experience. But Dr. Can we just get to understand, first of all, sinusitis? Because I'm pretty sure you've had a lot of people saying, sinus, oh, my sinuses are acting out and all those things. So let's get to understand it as an organ structure and then understand what it does.
So first of all of us have sinuses. So saying niko sinus is actually true because all of us have it. Yeah. So sinuses are basically, you see the bones around the nose are not solid bones. They are hollow. They have air inside. And this does a number of things. It allows the head to be lighter. It allows for resonance of our voice, like how a guitar does. It allows for insulation of the nose to maintain the temperature within a constant. So now the sinuses are those spaces, okay? And the lining of those spaces is the same lining as the nose. So it's actually a continuation of the nose into the bone. So those are the sinuses. And we have a number of paired sinuses, which is the frontal sinuses on the forehead, maxillary sinuses on the cheeks, ethmoid sinuses in the midline, and the sphenoid sinus behind the nose.
Okay, that we can't see, feel. Okay,
yes.
But I mean, we can't see it anyway. So is that why, and especially when you have extreme cold, you feel like your eyes, it's a bit of headache, and then, so that's why we get
exactly
the reaction. Okay.
Yes, and that is because now probably the temperature within the sinus may be different from the outside, from the atmosphere, and that will cause some form of discomfort. Yes.
Okay, and then we have rhinitis. Is it one and the same? Is it different?
So to talk about rhinitis and sinusitis, it's actually a continuation of the same condition because the nose and the sinuses cannot be separated. They're basically a continuation of each other. So the nose lining or the mucosa is the same as the one in the sinuses. Okay. So it's a continuation of the same. So rhinitis and sinusitis is actually a continuation of the same condition. So really, you cannot say that you have rhinitis without sinusitis or sinusitis
without rhinitis. But most commonly, we talk about sinusitis, not so often on rhinitis, which I think you'll help us understand as we continue with the conversation. But speaking to Amina, so Amina, you developed sinusitis, right? But from a post-op complication. Yeah. So do you want to take us through what happened? What led to your surgery first? And then we'll talk about then the complication after.
I had a surgery done to repair the CSF leak, which was successful. And then it complicated to a sinusitis, which led to a nasal polyps, which led to the sinusitis. And it came about with the nasal congestion, headache. Okay, those are the symptoms I was having before I even knew I had a sinusitis. Okay. I had the headache, nasal congestion, neck stiffness, and I had to go back to the doctor. And it confirmed I had a sinusitis. All right. And I had to go back for another surgery to fix the sinusitis. Okay.
How long after your surgery did you again develop the complication?
That was 2 months after.
2 months after your first surgery.
Yeah.
Okay. So doc, again, big words. CSF.
Yeah.
leak,
Yeah.
and then polyops.
Yeah, polyps.
Yeah, yes.
So CSF stands for cerebrospinal fluid, which is a fluid that bathes the brain and the spinal cord.
Uh-huh.
And one thing that people may not know is that the nose is a neighbor to the brain. So the roof of the nose is actually the floor of where the brain sits.
Okay.
Yes. So they're separated by only a bone in between. So sometimes you may have a defect on the bone, which may allow fluid from the brain to leak into the nose.
Okay. Yeah.
So when that happens is when it's known as CSF leak or cerebrospinal fluid leak.
Okay. And aside from that is sinusitis developing from as a form of complication, what are some of the other instances that might lead to sinusitis?
Okay, for her case, it was quite unique because probably what happened is that after the repair, there might have been an obstruction of one of the sinuses, which leads to accumulation of mucus, and that gets infected. Then you get now the sinusitis, which leads to formation of polyps. But generally, other causes of sinusitis are mostly related to allergy. And what happens is that the allergy causes obstruction of the sinus openings. Mucus gets trapped inside the sinuses, and then the mucus grows bacteria. So the bacteria then causes inflammation as the body is trying to heal. But that inflammation causes more swelling, and the more swelling causes more blockage. So it becomes a cycle that is not ending unless intervention comes. But there are other causes of sinusitis, and some of them are even related to allergy of fungal spores, which is known as allergic fungal sinusitis. The other causes of sinusitis, which are viral, and of course we have many different types of viruses, but usually these are mild. And sinusitis in itself can be divided into acute, which is short-term, subacute, and chronic sinusitis.
All right.
So if you had inflammation or infection of the sinuses for less than 4 weeks, that is acute or short-term. Subacute is between 4 and 12 weeks, and more than 12 weeks is chronic sinusitis.
Okay.
Yeah, so chronic sinusitis means most likely there's an obstruction of the sinus openings, and therefore the disease is perpetuating itself.
Okay. So when you say obstruction, so does it mean that it's inflamed, enlarged, or what exactly happens that then causes the obstruction?
So earlier I talked about the sinuses being the spaces within the bones that surround the nose. So the spaces are in communication with the nose.
All right.
So which means that the mucus that is produced in the sinus needs to be removed into the nose. Okay. Usually that is done by what we call cilia, which are small hairs on the lining which waft the mucus into the nose. Right. So those tubes that are draining mucus from the sinuses into the nose are the ones that can get obstructed. And once they are obstructed, then you have accumulation of mucus within the sinus.
Okay. All right. So Amina, you talked about headaches here and there. What are some of the other symptoms that you experience? Because it's just 2 months after your surgery, so it must be really uncomfortable, huh?
Majorly that was it. Headache and nasal congestion. I couldn't really breathe because my surgery was through my left nostril, and I was having the congestion through my left nostril. I couldn't really breathe. I was really trying to blow my nose really hard. I couldn't breathe through it, and my neck was really, really stiff. I couldn't move my neck. I remember I used to call the doctor all the time, like, I can't move my neck, I can't breathe. Sometimes I used to have pressure, like pressure headaches. I don't know if I can understand it. To my eyes, I can't move it. Sometimes photophobia. I don't know if it's normal. I can't stand light.
Okay.
Yeah, most of the time that was it. But the headaches were really, really severe. And I'm sneezing most of the times. Yeah, basically that was it.
So for the headache, was it like on and off, or was it?
Most of the times it was on and off, but when it comes severely with the neck stiffness. It used to accompany each other.
Yeah.
All
right, Doctor, do you want to take us through what that is about, and especially for the stiffness of the neck and pressure headaches as well?
Yeah. So the sinus is being neighbors to the head. Also, they share some of the nerves that affect or rather supply the coverings of the brain. So sometimes when you have inflammation within the sinus, you'll get headaches as well.
Okay.
Different headaches may indicate different sinuses being involved. The frontal or the front part of the head mostly is the frontal sinus, The back of the head, mostly sphenoid sinus, and on the sides, either maxillary sinus or ethmoid sinuses. So it can also give us an indication of which particular sinus is being affected from the kind of headaches that you have.
Okay.
Another thing is that most patients or most people who have sinusitis, when they bend, they'll feel like there's like pressure on their eyes or on their forehead.
Okay.
And this is because of the fluid within the sinus, which is causing that kind of symptom.
Oh, interesting. Okay. So very quickly before we go on a break, did you try and do something? I know you said you used to call your doctor almost all the time, be like, this is what I'm feeling, and you know, this is a thing. But did you try maybe like deal with it on your own before going back and getting that diagnosis that you have sinusitis?
Not really. I'm strictly a doctor's person.
Okay.
Any slight headache, I normally consult a doctor because, you know, for the CSF, I used to ignore it. Like I discovered it a long time ago. I ignored it until it became serious. So I'm a person, like any slight cough, I consult a doctor.
Yeah.
So basically, when it happened, I had to go to the doctor. I was given meds, and the doctor was like, just take the medications, and then we slowly treat it. If it worsens, and then we'll intervene.
Yeah.
It was around Christmas period. And then I took the medication slowly, but you know, it was a post-op complication. It wasn't going away.
Yeah.
And then now we resulted to a surgery in January. Yeah.
All right, so let's take a break. But then when we come back, we'll get to understand more on, you know, the surgery aspect of the same. And Dr. I would also want to know, do we have like other, maybe like defects that might lead to sinusitis, aside from the viral, bacterial, environmental, and maybe like a post-op complication? Are there other, you know, causes for the same? And the treatment as well. She talked about surgery, which again, we also want to understand more on the same. But all that is coming up after the break. Stay with us. All right, so welcome back. The show is Health Diary, and today we're talking about sinus infection, or if you like, sinusitis. And to help us with that conversation, we have Dr. Cyrus Karuga, who is ENT and head, as well as the neck surgeon from City Health Hospital. And we also have Amina Warsan Abdurizak Amina, the tongue twister there, with us as well, to share her experience. So, Doctor, can we quickly talk about the diagnosis? Because like I said, there's an acute sinusitis, but subacute, and then the chronic. So when it comes to diagnosis, what does that look like?
So for diagnosis, very important is the history that we get from the patient, meaning the symptoms I've been getting, what the headaches, mucus discharge, what color it is. Sometimes you have what we call post-nasal drip, where you have mucus dripping at the back of the nose. Loss of smell for some patients, as I said, headaches, pain in the face, especially when bending and such things. Then we need to do a good examination, which means we examine the mouth, the nose, and for the nose, it would be useful to use a scope, which is like a camera to see inside the nose, to see whether there's any inflammation or mucus that is purulent or has bacteria, or we can see polyps and any other abnormalities. If we need other investigations, the most important would be a CT scan, and especially if you're preparing a patient for surgery, because you need to know the anatomy of the sinuses, how they look like inside. And as I said earlier, the sinuses and the nose are neighbors with the brain. So we have to know how to approach the surgery to make sure that it don't cause any problems, either with the brain or even the eye, which is also another neighbor. So it's important to know how the anatomy
Very
looks
delicate,
like.
yeah. It's very, very delicate. All right. And before we went on a break, there was that question about maybe like defects in the body that might end up causing sinusitis. Can we go through it very quickly?
Yeah, we do have some defects which can cause sinusitis. And the main problem is that the either bony or soft tissue defects are causing blockage of the channels that drain the mucus from the sinuses.
Okay.
So you can have some bony defects that are causing obstruction of those drainage systems from the sinuses, or soft tissue. For example, you can have something we call concha bullosa, which is an enlargement of one of the structures within the nose that can block the exit from the sinus. You can also have bony defects in the structure of the sinuses. So those are things that are inherited or you're born with. But of course, other things are come later, like allergic rhinitis, which can lead to swelling of the tubes that drain the mucus and then obstruct.
Okay. All right. And speaking of allergies, I mean, we have some people who have like seasonal allergies. So I think when we talk about treatment, then we'd get to understand how that is for them. But for you, I mean, so very quickly, 2 months after your CSF surgery, right, you developed sinusitis. And I'm just trying to think, at this point, were you like healed properly before this came about? And how uncomfortable, that was, because you were given some medication to just help you, manage, but you had to go through surgery as well. So how was that process like for you?
Okay, it was hard, of course, because just first of all, like 2 weeks after my first surgery, it was hard because 2 weeks after my surgery, I got an infection at the surgical site. You can imagine that. And then I recovered. I went back to school. I wasn't studying in Nairobi, first of all. I go back to school. I was lagging behind, of course. And then I come back. I tried catching up. And then I was a nursing student. Assessments, case studies, you get research. I was behind other students. And then I came back. Then I got sick again. And that time it was Christmas period. And then, of course, the doctors have to rest also. Doctors are not available. You just work with calls and all. And then you're scheduled for another surgery. The other students are in the clinical rotation. I've missed a lot of rotations also. And then people are finishing their research. Me, I'm behind. At some point, I even thought of taking off the semester. To recover. I've not recovered from the first surgery, and then going for another surgery. And then this other surgery, also going for another general anesthesia. Everyone has their stories. Like, I don't go for another surgery, everyone has their stories. Like, another surgery, you'll go and then this will happen, that will happen. Everyone has their stories. But at the back of my mind, I still want to get better, I still have to do it. And like, I'm learned. I know how these things go. I had a good doctor, by the way. Was so encouraging. I still had to do it. Like, I just had to do it at the end of the day.
I think you have like a really good health-seeking behaviors compared to so many of us who ignore until it gets to a point where you can't take it anymore.
Yeah, I still had to do it. At the end of the day, I still wanted to get better because I was, how many months I was still on meds. It was starting from September. I was taking meds.
Yeah.
So I still had to do it at the end of the day. I was like, just do it.
Okay. So did the medication sort of like help a little bit, or as you prepare for
the meds?
Yes.
Yeah, the meds helped, although some of the meds had side effects like weight gain, which I didn't like.
Okay.
I didn't like the weight gain. I remember I used to complain every day, like, I'll stop these meds. Every day I'm like, maybe I'll stop these meds. I'm not doing it. But they helped at the end of the day.
Okay.
Like a win-win situation. If they're helping, I'll do it.
Okay. All right. So the pressure headaches, the, like you're saying, stiff neck as well, did that?
Yeah, they subsided with time.
Yeah.
After my surgery, everything was okay. With the time, everything went down slowly.
Okay. Yeah. All right. So are there other treatment options before surgery, or it depends with the severity of the thing?
Yeah, it depends on, first of all, what is causing the sinusitis. So things like viral infections, mostly we have supportive management, which is pain relief, keeping well hydrated, maybe reducing mucus production using antihistamines and such things. For bacterial infections, then we need to use an antibiotic, but most of the times we'd like to do like a culture or at least a blood test to make sure that we're treating a bacterial infection, or an endoscopy like we had talked about earlier, which will enable us to see the infection within the nose. Now, for some infections which are chronic, you may end up with what you call polyps, for example, what Amina had. And polyps are basically where the lining of the nose is getting stretched because of inflammation and fluid entering into the tissues. So that stretches the lining of the nose and makes like finger-like projections. So those are called polyps. So for polyps, we may need to do surgical intervention if they're not responding to medical treatment. Usually we start with medical treatment, and we aim first to treat the infection, because polyps are caused by an inflammatory process or allergic process. So we're treating the infection or the allergic rhinitis and giving anti-inflammatories to see whether that can reduce the polyp formation. But if that does not work, because polyps will almost always cause obstruction of the sinus openings, and that will lead to a cycle which does not end, then we may need to do surgical intervention to remove the polyps to allow the sinuses to drain the mucus. And that will break the cycle of infection and inflammation.
Yeah. And for those people who have like allergies, and especially the chronic ones, right? So then what happens to them? Because a lot of people would say, yeah, we have allergies. And we make it seem so cool to say, we have allergies here and there. But then this person tends to suffer, for a long time just because they have allergies. So I wonder what happens then in such instances.
So for allergy, you see, you have a large spectrum of allergy in terms of the severity of the disease and how often you get the disease. So most people have mild allergies where you have just mild symptoms which will affect your daily life. So day to day, you don't have any major issues unless you're exposed to whatever you're allergic to, then you have some symptoms. But other people have more severe symptoms where they have formation of now the polyps, recurrent infection, sinusitis, and those kind of things.
Yeah.
And other complications related to allergy, including nasal obstruction, which leads to snoring and difficulty sleeping and such things. Yeah. So that is more severe allergy. Okay. But also allergy can be persistent, in which case the allergy is affecting you almost all the time, at least more than 4 days in a week, or intermittent, which is occasional, like maybe 1 or less than 4 days in a week. So in that case, again, you don't feel the symptoms as much if it's a shorter duration. But people who have now severe and persistent allergy usually have the biggest problem.
Yeah.
And those are the people who mostly need the intervention.
Interventions, yeah. Okay. So very quickly on the surgery as well. So what is that process like, and the prognosis?
So initially we have to evaluate the patient, see what kind of surgery would help. For the principles of surgery for the nose, we do the minimum that we need to do for the maximum effect. So meaning most of the times our aim is to drain the sinuses and also to create an airway for the patient to breathe. So evaluate the patient clinically and also do a scan to be able to see the anatomy so they can be able to know the boundaries that we need to keep off and what kind of disease we have in the nose and what we need to do. So most of the surgery nowadays is done in endoscopically, meaning there are no scars on the face. So we use a camera that goes into the nose and instruments that can fit in the nose, and you can be able to do minimally invasive surgery that way, and the outcome is usually very good.
It's very easy for us to ignore. Some of us have really bad health-seeking behavior. So as we bring this to a closest part, just understanding how important it is to just go to a hospital. Even a case where you're saying, may I have an allergy? What is it that you would say to the people watching us today?
I would say that it's important for us, first of all, to know how our body is. And if you notice a change in your body, something that's unusual, it's always important to go have a doctor take a look at it. Because many things can be sorted out, can be treated quite easily, but some things, if ignored, can lead to worse complications. So let's not wait until things are so bad and then look for or go look for health care, because then it might be a little too late.
Yes.
So the earlier, the better. As they say in Kenya, mapema ndio best.
Mapema ndio best. I like that. All right. Thank you so much, Dr. Cyrus Karuga, who's an ENT and head as well as a neck surgeon from City Health Hospital. And of course, not forgetting, let me get the name straight, because there's Amina Warsak, Abdurizak, Amina. Why? Thank you so much for also sharing your journey as well today as far as sinusitis is concerned. Well, time now for you to take a look at this health tip.
Today on Health Tip, we talk about myths surrounding cleft lip and palate surgery. So there are some communities where they believe that this is a curse or a bad omen, and they ostracize the mothers of the children, the families, and the children as well. There are also some communities which believe that early surgery can lead to death or disfigurement. I think This is very far from the truth. What we encourage people is to take these children to the nearest healthcare centers as early as possible so that they can be able to get help.
Well, that marks the end of our conversation today as far as sinusitis is concerned. And like the doctor said, do not ignore anything. Let's develop good health-seeking behavior when it comes to our health. Understand your body so that in case there is a problem, you're able to pick it up as soon as possible and get to the hospital. But if you have any other question, our social media handles are down at the bottom of your screen. Let's have the conversation continue online. But for now, a special thanks to Dusit Princess Hotel and Residences for hosting us today. My name is Winnie Lubembe. Until next time, adios. Oh, uko sawa? Kwani umepoteza sauti?